Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
The topic we are discussing tonight is appendicitis, and we are talking once again with Dr. Jitka Lom from Express Care to talk about this. Doctor, we have some very insightful questions right now. People want to know exactly what this is. You know, prior to you coming on, I guess more people know it was a 50-50 chance if you get appendicitis. So we got some really good ones. You ready?
Yep.
All right, here we go. Question number one, gentlemen, if you will, please. Ralph from Manila, Dr. Lom asks, Doctor, what is the difference between gastroenteritis and appendicitis?
Okay. Well, gastroenteritis is an inflammation of the intestines where it's usually caused by either food, bad food ingestion, food poisoning, or a viral illness, or sometimes bacterial. But basically, your entire guts are inflamed all the way down, not just that one little intestine. And it tends to affect, not the little piece of the appendix, so more like the whole large intestine. And then the symptoms tend to be diarrhea. You can have vomiting also and a fever, but the main hallmark is diarrhea. With appendicitis, rarely do people get diarrhea. Sometimes, but not very often.
Gastroenteritis won't necessarily contribute to appendicitis, right?
No, not at all. No, because things are moving through the guts. And with appendicitis, things have gotten stuck.
Right, as you mentioned previously. All right, and number two, this comes from Chalampago, and Patty asks, Doctor, is there a way to prevent appendicitis? I've heard that a low fiber and high sugar diet are considered contributing factors.
That's true. If you eat things that don't have much fiber in them, you eat a lot of sugar, and probably you don't drink a lot of water, your guts tend to be pretty sluggish. You know, your intestines are not just pipes. They're actually a living organ that pushes the material through to the bottom end. And if you're eating things that are very sticky, like rice and highly processed foods, and not very many things with roughage, like vegetables or bran or high fiber foods, then your guts will just be kind of slowly, sluggishly moving along. You'll have a lot of gas and maybe some constipation, and it'll be more likely that a piece of food or of that fecal material can slide down into that appendix and cause you trouble. So, like with all the other conditions that we talk about, you should eat lots of vegetables, drink lots of water, and cut back on your sugar.
There are also some brands of yogurt I know that are available over the counter right now that are specifically to move it. Okay, moving right along, and that totally not was a pun because we are talking about laxatives, so I'm sorry about that. Dr. Lom, Donna from Tumon asks, will the use of laxatives increase the risk of rupture?
Well, I guess it could, yeah. Sometimes if people have a tummy ache too, they'll start taking laxatives or try to purge, or even enemas and so on. Really, probably not such a great idea unless you already know you're constipated. But if you have a fever and a tummy ache, don't take laxatives. Just lots of liquids, resting, not eating anything.
Yeah, like laxatives, I know when I was growing up, they said, unless prescribed by a doctor, even though they're over the counter, you really want to be careful with that kind of stuff.
Exactly.
Okay. Question number 4 comes to us from the southern village of Talafofo, and this is from Brianna. So Brianna, thanks for your question. Brianna asks, my doctor says I have to have my appendix removed. What can I expect of the surgery? We talked about this. This is a surgical procedure, and you will be put under.
Yeah. Sometimes they can do it laparoscopically, which means through like keyhole surgery. Just make a little tiny incision and then through a camera and clip, clip, and out it comes. That's nice. Other times they have to make a small incision about that long on the right lower area of your abdomen. And the operation itself is very quick. It might take only 20 or 30 minutes if there's a very expert surgeon, and staples or stitches when you get done. That's in a simple case where it's not ruptured. If it is ruptured, then the whole abdomen has to be opened, everything taken out, washed out, cleaned out, all of that, and that might be a couple hours surgery. So you want to get it when it's little, when it's just starting, and they can make it quite a simple procedure. Your recovery would be 1 or 2 days in the hospital and then at home for a week, and you'd be fine.
Okay, well that's a pretty good ballpark figure.
Pretty good.
And we hope that no one would go to the extent of it actually rupturing internally. And
right. You want to take care of things before they get really bad.
Absolutely. Well, our last question, of course, was from down south. Number 5 comes from up north, and this is from Joanna from Jigo. Dr. Lom, she asks, why are people with diabetes more likely to experience complications if their appendices rupture?
Very good question. Well, if your appendix ruptures, then that fecal material, meaning stool, is all over the inside of your abdomen, and that's full of bacteria. Then again, you're a diabetic with high blood sugar. It's like honey for the flies, you know what I mean? You've got a lot of sugar feeding those bacteria, and they will multiply very quickly, and you can get what's called sepsis, which is a severe whole body infection where the bacteria are basically overwhelming your entire system, and you're extremely sick in the ICU, and you have a very, very poor outcome there. So yeah, if you're diabetic and you've got a tummy ache, definitely get seen.
Yeah, when you get septic, it basically kicks in right away, right?
It does. It really can. Very high fever, chills, very, very severely sick.
Okay, we're going to go to our last question now, and this one comes to us from Christy from Mangilau, and Christy asks, are there foods to help with abdominal pain discomfort?
Abdominal pain?
Yeah.
Or discomfort? Foods. No, please don't eat. If you have abdominal pain, I think the only exception to that would be sometimes if people have eaten the wrong foods and they have a little bit of heartburn, some food might help that. But in general, if you have a tummy ache, abdominal pain, or you have vomiting or diarrhea, stop eating. You need to just drink lots of liquids, rest. You could maybe take a little Tylenol. More liquids, more liquids, more liquids, and not any food, because your intestines need to rest.
All right, like you said that. Well, thank you so much for reinforcing that topic.
Sure.
And, thanks for the knowledge. This is an excellent segment tonight.
Thank you.
All right, thank you. And stay tuned, everybody. More KUM News Extra will return after this, but the doctor will be back next week when she will be talking about tics and twitches, another interesting subject, so make sure to tune in for that. But stay right there, because there is more, including news you need to know about the alarming rise in heart disease on the island. We're back after this.